Hello everyone, welcome to Digital Health News. Welcome to today's episode. Today we have the honor of hosting Mr. JP Dwivedi, a distinguished senior leader in the IT industry with an impressive 30 years of global experience. Currently, he is serving as the Chief Information Officer at the Rajiv Gandhi Cancer Institute and Research Center. Mr. Dwivedi is deeply committed to harnessing the power of information technology and process automation for enhancing patient care. With his extensive background and forward thinking approach, we are excited today to dive into his insights on how technology can improve and modernize cancer care and how he is doing it at RGCI. Thank you so much. Thank you so much, Dwivedi sir, for joining us on Digital Health News CIO podcast today. It's a pleasure to have
Thank
you
you
with us.
for inviting me. Thank you for inviting me, Aarti.
All right, so let's move on with our first question. My first question to you is you transitioned into healthcare information technology in 2009. It has almost been over a decade now. How have you seen this entire sphere change or evolve over the time?
Oh, it is dramatic change. Healthcare was lagging behind in IT enablement. In 2009, when I came in this healthcare IT field, I started my journey. I was employee of Dell, and I was working with Max Healthcare, working on their digital transformation side as their supplier. And since then, I saw the initial couple of years, I was in charge of implementing electronic health record system there. And that brought me to Rajiv Gandhi Cancer Institute. The institute was looking for a senior seasoned professional. And I was, to be honest, I was looking for deep domain expertise. My intention was to go back to corporate as a practice head after spending 2, 3 solid years. But the DNA of this organization glued me, and I'm inside the black hole now. And I aim to retire from here. So this was the starting. Now in 2011, when I came to Rajiv Gandhi Cancer Institute, I saw ICU where the nurses used to create and maintain 120 different types of paper records. Those included registers, forms, and lots of different paper instruments. And I wondered where the nurses get time to treat patients. So that was kind of awakening. Uh, all the even normal communications were mostly paper based. Email was there, but it was not very much in fashion to use for official communication. So from that point, and now where I see every doctor looking at the computer to see the patient's history and all the reports and results and trends, etc., and yelling at me when there is a downtime of 10 minutes. So this is a very welcome change that I see. And we are very much experiencing the transition from push experience to pull experience. Now we are very much in demand and very much part of the mainstream service. So it is really a good feeling to be in, although it has not been easy. So every transition is painful, but we have passed through the pain from the business side as well as from the IT side. And now we are where we are.
You have led some of the major IT modernization efforts at Rajiv Gandhi Cancer Care Hospital. And I mean, it's a specialized cancer care hospital. So, how do you tailor your IT modernizations to meet the unique needs of the institution? And can you share some specific technologies or automation processes that you have implemented?
Yeah, so it is a long journey. I'll try to be crisp and short. I basically created Maslow's model of hierarchy of needs. So it is a 5 different layers. Base layer being the infrastructure layer. The second layer being the ERP layer, where the basic foundation modules like purchase, finance, HR, etc., are placed, the asset management. The next, hospital information system layer, where billing, patient management, ward management, operations management, etc., sit. Then subsequent layer, electronic health record. And then fifth, the digital technologies layer, the utopian layer. And we started from the bottom up. So fixing the infrastructure layer first, modernized our data center. It was in the lower basement and it was not in a good shape. So we first time created a false flooring and then uplifted the servers, and starting from there, uh, dressing up all the networks, which is creating redundant lines of network to communicate. We, of course, now are sitting in a state of art modern Schneider Electric modular data center, which is comparable to any cloud service provider's infrastructure. Then we moved on to the email and communication system and placed our DR center with a prominent data center provider in Hyderabad. And we asked them to manage our email and then start monitoring our infrastructure remotely 24 by 7. So that was built. Then we, of course, upgraded our compute and storage facilities to really host good, resilient, and well-performing applications on them. After covering the infrastructure layer, then moved on to ERP. And we did not want to compromise, so we chose one of the best ERP systems. We found that SAP and Oracle were the leaders, so we chose SAP. And then we embarked upon implementation of SAP. And then in 2018, we were up and running with SAP. The finance and control, materials management, and human capital management, the payroll and organization structure part of it. In parallel, we were working on perfecting our billing system. There were some glitches, some issues. We streamlined our billing system that was part of HIS. So billing, laboratory, and radiology services were our focus area. There we changed our PAG system because the PAG system available at that time did not have a good RIS, radiology information system. It did not have teleradiology and mobility facilities. So we changed that and implemented a new PAG system at that time. In 2017, we went for our in-house pharmacy also. So pharmacy at that time was outsourced. So another HIS module was enabled and the pharmacy was integrated with billing at one hand and the inventory management on the other. So we implemented that. The Niti Bagh unit, the other unit of the institute, was opening. So in 2017, we started that unit also. So our hospital expanded from single unit to multi-unit. So there were some technology-related requirements there. So we spent significant time in fulfilling that. Then it came to electronic health record implementation because the EHR system that we had at that time was a generic EHR. It was an American product which was meant for all sorts of hospitals. So it was not really welcome by our clinicians. And I have seen with my own experience that software is only welcomed if it has two attributes. One is that it is content rich. So the software should look like the software working for their business, the user's business. So it should be tailored to oncology in our situation. And second is it should be context sensitive. So the user will demand that you do not show me 100 different choices. Show me only relevant 4 or 5 so that I can select one of them. Make my workflow so easy that it does not eat my 3 minutes to really create a prescription or put up notes there. So, taking those challenges, resistances from there, when we started looking at what is the maximum volume area, and we found that 60% of our patients' visits were related to medical oncology, means chemotherapy, immunotherapy, targeted therapy, etc. So we decided to target medical oncology area first. And along with the HIS partner, we created the automated chemotherapy workflow. And in that workflow, doctor just has to select the organ where the problem is. It will show relevant 4, 5, 6 protocols. Then doctor just has to enter the weight of the patient. Height generally does not change unless it is a pediatric patient. So once height is recorded, weight is recorded, some allergies and known conditions are one time recorded. By this virtue of having the height and weight, it automatically calculates the body surface area. And then you just press the button for the calculation of dose. And system will automatically bring in all the related medicines. So it will start from the anti-emetic medicines to prevent the nausea, etc. Then any prehydration requirement, and then actual chemotherapy, the neoplastic, anti-neoplastic drug, and then the post-hydration, and then flush. So all sorts of medicines coming together along with the solvent, the total dose, how much the quantity of solvent has to be there, what should be the speed, and in how much duration it should be administered. Everything put together. Doctor does not need to worry about packaging of the medicine. So if there is a requirement of 1275 milligram of the drug to be administered, doctor's order will be created with 1275 milligram only. Then this particular protocol that is created by junior doctor generally, it goes to senior doctor for approval. And then senior doctor has two options. One, either edit or approve. The edit includes cancellation, rejection, of course. Once it is approved, now it will go to clinical pharmacist. Clinical pharmacist will match the dose ordered with the packaging available, and the system will not allow to move forward until the complete dose is covered. So in case of 1275, it will wait for the pharmacist to enter one vial of 1000 milligram, another vial of, let us say, 200 milligram, and third vial of 100 milligram, and then it will turn green. So once that is there, pharmacist will press button, it will go to the nursing counter. So we automated entire workflow this way, catered to specific users' needs without applying any super duper technology like AI, etc. It is just like any other billing program. But this was really a game changer. Once I gave this for one or two protocols, I could see some interest on doctors' part. They started participating. They gave plenty of meaningful inputs, and this product started maturing. In a period of around 14 to 18 months, we could see from 10% adoption to 97%, and it continued thereafter. Now when the new regimen comes, they will be behind our life to actually configure it, so that they don't want to put it on paper. Now they want to use it online. So when people blame doctors, I laugh that I also used to do at one point of time. So lot of such things, working shoulder to shoulder with our doctors, nurses, and different administrative officers, we could really do a lot for the institute and patients.
This is such an interesting and very unique insight from you, sir, because I think most of the CIOs talk about how change management is difficult and how doctors are the most adamant and they do not want to, readily adopt to the change. How has been the experience at Rajiv Gandhi Cancer Institute as you touched upon briefly around it? So, would like to know in detail how did the doctors respond when you were implementing all these innovative strategies and technologies?
See, initial response is always rejection, and that is with any change. Because when you are forcing somebody to change the way that person is practicing, it is very natural for a doctor to think that the patient comes listening of me, hearing of my name. I write the prescription, I perform the surgery. Who the
Hmm.
hell are you to tell me how to do my own business? So that is naturally very first and natural reaction. But when you achieve one, two, or three successes together, you start building some trust.
Hmm.
Now, any relationship has a demand and supply side. You cannot simply keep demanding of them to transform their way of working to suit management's or technology's perspectives. Management or technology has to fulfill their legitimate needs. We should care for, improving clinician productivity, improving patient safety, improving the experience of the patient, some sort of cost reduction that is coming. Of course, doctors will welcome. And the second thing is, if they don't feel like owning these changes, they will not welcome it. So it is good that they are the people who understand their business best. We should not try to pretend that we know better than them on how
Hmm.
to automate a particular workflow. They are very smart people. I think doctors are the smartest people, and I'm not trying to flatter them, but they are trained this way. Somebody is dealing with this body that is God's creation, that has thousands and thousands of parameters, rather millions, and they are dealing with all these variations with very limited tools. So they are smart people, and we need to respect them. Once you get that rapport with them, and you develop that confidence in them, that you care for them, and you are working to improve their life, then they start listening. Sometimes you need to push also, because there is a balance between telling and selling, and you need to judiciously apply all that. So sometimes you need to work like a corporator, sometimes you need to work like
Hmm.
administrator, sometimes as technologist, pick up different tools as per the demand of the time, and it works. And once they saw that chemotherapy experiment succeeding, then I picked up entire OPD setup, and it
Hmm.
included surgery, radiation, everything else, and even medical oncology beyond chemotherapy. And it was all welcome because it was helping them in doing their job better. It improved the treatment
Treatment
start
start
time,
time, early start time
after
after
the
the
admission,
admission.
because at that time people used to wait for files and it was up to 3 4 hours. Now every order is already waiting online, and everybody knows that this order is now very much, it is much more legitimate than the file itself, because in file
Hmm.
there is a chance of any transcription error from one hand to other hand. Here you are receiving directly from the doctor without any touch. So there are a lot of plus points, and once they see it, they welcome it. Again, I will say the key is always take care of two things. Keep the software content rich, and make it context sensitive.
Absolutely. Uh, After COVID-19, especially Mr. Dwivedi, I think the patient needs and patient expectations, patient demands have also changed. A lot of people who used to visit doctors earlier now prefer to go the telemedicine way. RGCI has also launched its own telemedicine app. Could you share the story behind this initiative and how it has changed the way you manage patient care?
Very interesting, Aarti. So, when this COVID struck, even my inner feeling was, what do I have to do with telemedicine? Because
Hmm.
you see, you either perform surgery on the patient, or you infuse chemotherapy, or you administer radiation. Nothing can happen remotely. So, why do I need telemedicine? But then, when this pandemic struck, we needed to avoid all the unnecessary visits to the hospital.
Hmm.
Initially, patient is not sure whether really there is an onslaught of cancer or not. So patient wants to talk to a doctor but then doesn't want to get infected. Doctor also thinks that it is better as less number of patients come in physical contact as possible. So we did not have the app. So what we decided that we had a donation link in our website. So we
Hmm.
started using that donation link with minimum tinkering, that we can receive the money from the patient online through a very small variation from the donation link. Then I reached out to Cisco and I said, give me 25 licenses of your WebEx so that video conferencing can happen. And that time they generously extended it. That was just on a pilot basis so that we go for a full blown. So it was a generosity or it was a business expenditure. They know the best, but we had it. So with these two tools, working together, we stitched a solution,
Hmm.
and then we convinced our doctors to go to the WebEx as per the link. We deployed two telemedicine coordinators, and with the help of them, we started telemedicine practice. It was so welcomed by all the doctors, the management, and the patients that at least there was something available. Then we started working on improving our. So there was a telemedicine app available with our HIS partner, but it was nowhere close to what it is today.
Hmm.
So we started working again with our doctors. We had some rapport with them with the success of chemotherapy and a few other modules, and it gave us some credibility. Those doctors spent time. We started spelling out the requirements, and we improved their menu and everything. And then the first version of the app came that it was deployed in Germany in their data center on their cloud. And then we started on this hosted model and we built a bidirectional link with our HIS system so that whatever data is being entered in telemedicine system comes back to our HIS database, and then they can fetch the related fields from HIS to display to the doctor. And then we built the links to send the reports, etc., to the patients. Now we have full fully developed patient portal and the patient app RGCI care. In fact, it is now integrated with the navigation system also. So when patient
Hmm.
comes, there is an icon. It is only implemented in 2 floors at the moment as a pilot. It will be expanded once we see a good initial success. So this way, the telemedicine app for patients came. Then we created a similar app for doctors also, so that doctors can see the patient records remotely and they can also check while on the round.
Recently, you have also conducted India's first telesurgery for cancer patients. Can you tell us more about that experience and its significance?
So this is a great success story. This surgery was done remotely from Gurgaon. Our
Hmm.
medical director, who is also a uro-oncologist, is a surgeon. So he
Hmm.
performed this surgery from there, and it was a patient was lying in our operation theater in our hospital, and remotely he was conducting the surgery. Of course, it was supervised by two surgeons who were very close to the patient and right at the operation table, but without their intervention, that surgery was conducted. And one good thing is that this surgical robot that was used in this surgery is made in India. So that is SSI Mantra, and we are very proud of it. Our surgeon, Dr. Raval, he has been one of the key contributors to the knowledge bank while building this surgical robot. He has done a lot of such innovative things, and this country and industry is has to remain indebted to him. So we are all very excited and very proud, and we will do more and more.
Well, congratulations to you and your entire team. This is no small feat. Technology is continuously changing, technology is developing, and as a CIO, you have to find out ways how you can inculcate those technologies to improve patient care. So, congratulations to your entire team once again. My next question to you is about the technology shaping the future of cancer care. How do you see more technologies being integrated in RGCI, as well as what are the exciting projects or initiatives that you have in pipeline?
6 years back, uh, I was in a conference, and the speaker said that if at all a credible cure for cancer comes, it will not come from an oncologist. It will come from an IT professional. So
Wow.
I was surprised to hear that, but I am now tending more and more to believe it, because you see, you cannot do genome sequencing
Hmm.
without IT. A lot of IT infrastructure, IT applications are now working hand in hand with doctors, and they are actually taking the clinicians several notches up in achieving the precision, the accuracy, the speed that they need to deliver the care. So the patient's reach, the care delivery, the cost optimization, patient experience in all different aspects, diagnosis, treatment, procedures, everywhere IT is working hand in hand with doctors, paramedics, nurses, and everyone. So I can see that this emergence of generative AI, 3D printing, all these technologies, machine learning, deep learning, lot of simulations, lot of robotic process automation, BI. So I call it AI, BI, and CI. So of course, everybody knows artificial intelligence, business intelligence. But then the CI is a new dimension, that is clinician imitation. So a
Wow.
robot imitating a clinician and acting like a clinician, of course, under active supervision. So technology is not yet daring the doctors. They are working as their, soldiers, commanders, or whatever you call them, their disciples. But these robots are getting more and more and more powerful, and they will at least be able to conduct the mundane tasks and leave only expert jobs with humans.
Absolutely. So you work with many technology vendors and innovators. If there is one particular technology that you would personally like to integrate in RGCI in future, what would that be?
So I'm very keen to really expand the use of generative AI.
Hmm.
That is one area where we can work, and it can really help in many ways. We are already using AI in diagnosis. We have started in a small way in generating automated discharge summaries
Hmm.
to reduce the discharge time. So far, the success looks promising. But generative AI has a lot of future, and it will help us in streamlining the workflows to a significant extent.
Absolutely. One last question, sir. Before I let you go for today, I think I've taken a lot of your time already. What would be your advice to your peers, other CIOs who are managing healthcare and patient care in hospitals?
So, my advice to CIOs will be that see, the journey is now, uh, it has gone to several milestones already. Now there is no resistance, there is no rejection, there is always a demand. You try to put your feet in the shoes of business owners, the stakeholders, the doctors, the nurses, the users, and the patients, uh, and just feel what real need is and try to fulfill the need in a very humble way. Never ever try to push any solution because people don't like change. So uh, there is a lot of selling business, and be careful never to oversell because you need to look at your supply side also.
Hmm.
Uh, Try to strengthen your backyard. And one big devil now is a cyber threat. So
Hmm.
be very much aware of that. It can really backstab the organization significantly and can create a big blow. So data security, privacy is very much important. Try to always work improving, strengthening the cyber posture of the organization. Never ever do any cut short in this particular aspect, and engage with fellow CIOs so that we learn from each other and share the knowledge, work together. That is how we have to really improve the ecosystem altogether.
Absolutely. I think that's a fantastic message from you, sir, that CIOs have to engage apart from the technology vendors and their clinicians. They also have to engage with fellow CIOs and learn from them, learn from their successes, learn from their mistakes. Thank you so much for this conversation, sir. Thank you so much. Have a nice day.
Thank you, Aarti, and you. Bye.